So hi everyone, good evening to all. Okay, right. I hope I'm live. I'm clearly audible and visible to all of you. Yeah, hi SM. NEET PG 2024 preponed to 23rd June 2024. So yes, that has been preponed. Uh, Definitely, that has been preponed to 23rd of June. Okay, so I'm just going to take up all your questions, all your things that you have asked me in the e-Gurukul section. So just I'm waiting for a while so that others can join in and we can start talking. Hi Saloni, hi Bluebird. Okay, so big day. Okay, and today we were planning to discuss about certain strategies, love for medicine. Okay, so today only we were supposed to start the discussion on how to utilize the last broadly 8 weeks that we have. Okay, and I'm fed up of all this. Please talk about NEET PG2 after INICET. Yes, definitely. Not only you, there are so many like you who are kind of fed up. Sometime it is postponed, sometime it is preponed, and it is fluctuating more than the Indian share markets. So yeah, hi Sarah, good evening. Hi Mohan, good evening. So guys, the session is supposed to be about the last 8 week strategy that one should have if you are targeting the INICET exam. Definitely, that is the whole idea of this session. Okay, but then definitely there are so many other things also that we should be talking about, and this session in this one only. So I'll try to take up all the issues that you have shared with us, all the concerns that you have shared with us, and definitely the biggest discussion of the hour is the preponement. Right, on the one hand, when the aims people have not like preponed, postponed any of the things because of any xyz reason, and now here we have the NEET people again doing something which has never been done earlier ever. There has been news of postponement, but preponement definitely I think it has been happening for the very first time. So let's see what they have planned for us. Okay, so now this INICET basically, guys, now these are the kind of questions that when I was like going through all the questions that have been sent to me from our eGurukul chat box, right, the Facebook, the Telegram chat box. So these are certain questions which I got. Okay, and the team has forwarded me, sir, kindly provide a timetable. My target is like INICET exam. Other one, what to study now in these last 2 months broadly I have. What should I study? How many revisions have to be done in these last 2 months? How to effectively utilize these 2 months to get a decent score? Okay, and then we had this one, how not to use these 2 months effectively and mess up with the preparation. That means you are already prepared and you don't want to do anything which can actually mess up your preparation, isn't it? That was the whole idea. How many GTs we need to give, a study schedule, kindly provide a timetable. And there were so many things which were asked here, and I was reading good before the postponement news. Now this is a couple of hours back, so I was doing well, but the news of postponement, that stopped my everything. Right now that is not something very good, and break after the postponement news affected me badly. Is this time enough? How do I start again? And I literally want to crack the INI. Please do guide. So these are certain things which I have kept over here. Okay, and I just want to discuss each one of them definitely. But before that, yes, one thing which I will not be agreeing upon is that, guys, if you're targeting your INICET exam or maybe the NEET exam, then this is not a question to be asked that what is a decent score. There is nothing like a decent score. Either you are getting through it or you're not getting into it, right? So there always has to be a target that is supposed to be fixed in your mind. So there is nothing like a decent in our medical field. It has to be a simple yes or no. So when you are targeting the AIMS exam, the INICET exam, the four premier institutes of the country, then the thing that should be in the mind is my college and my seat, right? It shouldn't be a decent one that I'll be accepting anything that is being offered to me. So don't be a beggar, try to be a chooser, right? So always remember that beggars will never be a chooser. So work to that level where things are in front of you, that you have all the options. So always keep that positivity in your mind. Always have that strength in your mind that yes, definitely you can do it. Okay, so decency, I don't think that's a good question to be asked. Fine, so let's take up all of these one by one. Okay, so INICET exam, the date is already known to you. It's 19th May, and broadly we have like 59 days to go till now. And this is another bouncer coming from our own superhero, the never ending multiple challenges, or you can say the changes society. Okay, so in short, you know what we mean to say and what we can elaborate now. So these are definitely the changes, or you can say challenges, which are being thrown upon the students every time you are thinking about NMC doing something good, and they come up with another level of bouncer. Okay, the kind of questions they may ask, the pattern of questions they may ask, the variability in the questionnaires, the weightage of the subject, and they keep on doing the shuffling of with everything. Okay, so definitely the never ending messed up things are being given to you today itself. So now, but I would like, it is not just to calm you guys down. It is, we have to understand certain things are not in our hands, right? We don't have the power to change the things all the time. You couldn't go to the court, and all those things are kind of wasting all your time all the time, and the energies all the time. So why not to think about these things as an opportunity? So this is the notification that has been released by NMC today, and now the NEET PG exam has been preponed to 23rd of June. You can see here, result of this result will be declared on 15th of July, and then counseling is supposed to start from 5th of August, and it is going till 15th of October, and the academic session is going to start in the 16th of September, they are saying. Okay, and the time frame they have given to you is joining is 21st of October. Now this is the schedule now, which is available on the NMC website. You can go there, you can download that, and you can see it yourself. It is there. Couple of hours back, or maybe kind of half hour back, the NMC website was down and it was not opening. But my take on this would be, yes, for the very first moment, I also have a lot of anguish, lot of anger that I'm not sure that how many people sitting in the NMC have actually given the exam, and how many of you like these people are putting the brains onto it, like how many students are putting their whole heart and soul into their preparation, and every time they do not even hesitate to change the dates like this. Okay, I'm not very sure what they are up to. Okay, so let's see, just these are few minutes or maybe few hours, we will be like discussing about all these things. Sir, preponement ho gaya, postponement ho gaya. Now whatever was supposed to happen, they have already declared officially, right? So what I would like to just tell you all, that it is always about the attitude, the view, the thoughts that make you what you are. Okay, and I'm again repeating that I'm not just saying you to calm you down. I'm not just saying you anything to just justify the act of NMC. I am definitely not in favor of this. But yes, as your faculty, as your colleague, as your partner in studies, till you crack your PG entrance exam, I can definitely tell you that the pessimist, we know that we have two kind of people, the pessimist and the optimist. So pessimist always will have the complaint about everything. But yes, I know none of you is a pessimist, and you always have been looking up to all the challenges in your life, and that's why you are here. Okay, so optimist expect that it will change, but definitely we don't expect that much of change. But now you have to be the realist people. Okay, whatever has been given to you, now this is the time where you are. So you are one of those bunches of the chosen ones, actually the best one and the privileged one, who are the realistic one, and who can just change any kind of tide, any kind of wind in your favor. Okay, so now I would say that you have to adjust to it, and the more quickly we can do that without wasting any time, it will be easy for us, right? So the 59 days that I'm telling you is from tomorrow onwards, or tomorrow morning onwards. So we are discussing today at 7 o'clock in the evening, and whatever I'm going to discuss with you is all the preparation strategy that I have for you for the next 59 days, starting from tomorrow morning itself, right? So let's utilize this opportunity to the maximum. Whatever is there in front of us, we can't just change it, we can't just or deny this. Yes, it is there, let's accept it and start working on that. And that's what I personally believe. Whatever is a challenge in front of me, I'll take it. From the moment I hear it, I'll take it. I'll not be just trying to justify that, okay fine, this is wrong or this is right. I cannot change it, so I'll take it and I'll try to sort it out. That is my take on this. Okay, so why only INI? Let's bring this challenge into an opportunity. Now the exam of this INI exam is in May month. June month you are going to have the NEET exam, just a month apart. A month and kind of 2 days apart you are going to have the exam. Okay, so why only to prepare for the INI, or why only to prepare for the NEET? Those students who are going for NEET should definitely try for INI. I know that it is going to increase the competition a little bit, but that's good. Healthy competition is always in favor of everyone, right? So I would recommend, I would highly suggest that anyone who is going for NEET or INI, you are going for both the exams actually. And the first exam has to be definitely the first exam that you're going to give is the INI exam, right? And definitely the strategy has to be accordingly. So why not to give the first exam as if it is your deciding exam? And even if a minutest of the thing is remaining, you can definitely go for the NEET exam, right? So INI strategy is the point, the session for the day, and I'm just going to talk about INI. And if you are the one who is looking for a change in your own schedule, own daily academic activities, then definitely everyone is there to help you out. But right now let's focus upon the INI, and this preponement of the NEET, let's utilize it as a weapon to crack the exam, the INICET or the NEET, right, in the very first go. So let's start what I have for you in the very short way. I have planned a few points for you, and I just want to discuss the very important things. See, the INICET exam is always and always about the practical things, not only about the academics, but about managing your time as well. Your skill testing is very much required, and that is what they are doing all the time, right? So when you are going for the strategic planning of the this INICET exam, the time management is very important. Let's talk about a few points which I want you to emphasize upon when you are going for the INICET exam. See, one of the questions that we saw on the very first slide was, sir, how many revisions are actually minimum required? So I would recommend, with these 59-60 days in your hand, I would recommend that you should at least go for 2 revisions minimum, right? That is my take. How to do that? Now it's like up to you how you make your strategy. I can give you one easy way. So what you can do is you can divide your time into 2/3, 1/3 kind of management plan, right? 60%, 75%, 25%, like that. So what you can do, you can divide your days into 2 parts. The part 1 is going to be your 40 days, the initial 40 days, right? And the second phase is going to be of 20 days. Those 20 days, this after 40, we have another 10 days and we have another 10 days. So that is broadly 60 days I'm telling you. Okay. So first 40 days is supposed to be your revision 1 of all your 19 subjects, right? And then other 10 days after 40th, the 41st to the 50th day, I would recommend you to go for the PYTs. PYQ is definitely important, but then focus should be upon the PYTs and not only on the PYQs. Now it is very important to understand the difference here. Okay, the PYTs or the PYQs, most of the time it will happen that in certain subject that I'm only focused upon the PYQs. So PYQs are important, definitely, no doubt in that, but it is always advisable that you must go with the PYTs, not only the PYQs, right? That is very important thing. Topics, always understand in your exams, whenever you're going to any of the exam, the INICET exam or the NEET exam, the topics are repeated, and all the time answer usually doesn't stay same. A question of orthopedics, if I say the giant cell tumor, if you look at last 5 years, they have been asking you GCT all the time, changing the language of the question as well as the options. So whenever you are going in the exam, do not go there with the prefix mindset that my exam, my question is going to be on the GCT only and my answer is going to be particular thing. No, don't do that. Okay. So these PYTs to be done from the 41st day to the 50th day, and from 51st to the last day, the 59th day that you have, you are supposed to learn the volatile topics, the points which are usually coming up from your 20th notebook, which I'm presuming that most of you, all of you would have definitely made. So that 20th notebook is definitely required, and by this time every faculty tells you that you are supposed to make it the most important volatile points, right? The high yielding topics, and from where are they coming, I'll just discuss that also with you. Okay, now allocation, how it has to be done, let's talk about these 3 steps one by one. The very first step is to divide your timing into the 40 days, right? So I am giving you a brief schedule, like somebody asked from me, sir, give me a schedule, I'm not able to make one for me the last 19 days. So I'm giving you the schedule, right? So this is what you can do. You can divide your subject wise weightage for first 40 days like broadly this. Depending upon your level of preparation, you can make a day up or down, but yes, definitely that is what I'm telling you. Anatomy, you can give it like 3 days. Pathology is another big subject, we have to give 3 days. Physiology can be covered up in 2 days. PSM, you know that it's a very high yielding subject, and yes, 3 days. OBGY, a very big subject in itself, 3 days. And the SARPU subject, all the skin, anesthesia, radiology, orthopedics, all of them has to be given 1 day each. So that is going to make total of 5 days for these 5 short subjects, including orthopedics as well. Pediatrics, 2 days. Forensic medicine, again 2 days. Ophthalmology, 3 days. Pharma has been given 3 days. Medicine, I've given 3 and 3. Now as I said, you can just make it a level up or down depending upon your current level of preparation, but yes, this is a schedule that I have for you for the next 40 days. Now these micro and biochemistry, okay, I marked specially highlighted in red. Why so? Yes, the weightage that has to be given can be defined, definitely the 3 plus 2, it can be done, but then I want you to revise these two subjects at last, because the questions here are, most of the questions are kind of volatile, which I tend to forget, which I tend to don't remember most of the time. There is no simple mnemonic for them, and they feel like a burden on me. Okay, so those who are DBMCI student, I can tell you for microbiology, there is nothing better than Dr. Nasir's note. I can bet on this thing. Okay, if you have Dr. Nasir's note, just revise the whole micro from that. And if you don't have that Dr. Nasir's note, and if you're reading from your own notes, right, what you can do, if you don't have the notes, then definitely the first aid book is coming for your rescue. Whole biochemistry, whole microbiology, you can revise in kind of 3.5, 4 days. Even the 5th day can be saved. Okay, so first aid book is something very, very important. You can just read from there. The most of the things that usually the INI people are asking you, the AIMS people are asking you, they are coming from that only. Okay, so microbiology, biochemistry, these I would recommend you to revise at last of all the 19 subjects. So 17 done, go for micro and biochem, because these are supposed to be read, seen again and again. Okay, that is a recommendation I have for you. So day-wise weightage, this is what you can do, right? This is a subject-wise study plan I have. Now, one of the most important thing, see guys, when you are revising INICET, a little burden is there, pressure is there for your NEET exam also. One thing I would like to focus upon, as we are always doing in all of our session, is please just focus on your own notes. Do not run after that my friend is from particular platform, I am a DBMCI student, I should run there also. I am from that platform, my friend is in DBMCI, I should learn from that also. Don't do that, please. Okay, just trust your own notes. It is not the right time where you change, you shuffle your notes. So your own notes are going to make the difference. If you have whatever source you might be having, trust that now. Okay, so own notes, having this is a boon in this time. Okay, and please do not run after the multiple things that you might be having around you, in your colleagues, kitty. Don't do that thing, right? So most important thing, own notes, own booklets, own kind of compilations that you might have done for yourself, the tables, the flow chart, the images, everything, your own things are the best ones right now. Okay, number one. Second, the most important thing is, while I am following this 40-day schedule, should I be giving some GTs? 100% you should take out those 3 hours, 3.5 hours, and kind of that every 10 days I would recommend that you have to give the GT. Now just giving the GT will have lot of mental impact on you. Either you are doing pretty well in the GTs, or you might not be doing that well in the GTs, but that should not hinder your preparation way. That should not be an obstacle to whatever you are preparing for your, or in the schedule manner, whatever you are doing, it should not be a hindrance. Okay, let me tell you a few things. See, whenever you are giving a GT, okay, one of the most important thing about the GT is that you must review it very, very properly, and that review ideally has to be done on the same day. You shouldn't be like lingering on that, okay fine, today is like 10 o'clock, 10 p.m. in the night, and I'll be doing it tomorrow morning. Please do not do that. Idealistic way to revise your GT is on the same day, and when you're doing that, please make sure that whatever way you are planning your studies, or maybe my schedule, whatever I'm giving you, if you're doing that, it has been a trend in the INI exam that basics, the foundation subjects have been given more weightage, more than the clinical ones. Yes, because most of the base of your clinics is based in the foundation subjects only. So when you're looking at the paper, 60% of your paper usually comes from the first and second year subject. It might be hearing like, if you are going for INI and you have been preparing well for a long time, you know this thing very well, right? 40% paper is a direct questions which are coming from your clinical subject. But then again, I'm saying my point, all the clinics, they have their base in the first and second year only, right? So whenever you are giving your grand test, okay, one thing is about reviewing the GT. Second most important thing is the time management. When you are going for the grand test, time management is very, very important. Okay, you know very well that AIMS people, the INICET people have changed their way of asking the questions. Paper doesn't come as a single paper. It is coming in bifurcations, and each slot has been given a definitive time period. I'm sure you might be knowing it. So now when you have little like kind of 60 days left, it is the time then where you should actually start practicing in the same way. That can I complete those 50 questions in those 45 minutes? Can I do that? Okay, so whatever time period you are devoting for your grand test, the 2 hour time period, 3 hour time period, 4 hour time period, 6 hour time period, whatever you are devoting for yourself, idealistic way is now you must be trying to cover up these 50 questions in that 45 minutes of duration, keeping a track of that, because you should know this, you might be knowing this, that after those 45 minutes your question, that part will be auto submitted. So even if you're not clicking on that submit button, it is going to get auto submitted, so it is not in your hand. So this is the right time, right moment where you start practicing. Even if you have some of the subjects left for revision, I would highly recommend that you must start practicing in the same manner, start submitting your paper in these time duration only, right? And the most important thing would be, whenever you are preparing, no, please do not try to run after the shortcuts. I got a message that, sir, my particular subject A is not complete. I have not name the subject here, but my subject particular, this one A, is not complete. Should I go for some quick revision, notes or videos? Please do not do that. You still have time and you can cover up all the subjects in a very proper manner. But yes, where to use those one shot videos, one shot revision program, I'll just tell that also. Okay, so GTs definitely are very important. Make sure you are submitting 50 questions, or you are trying to cover up 50 questions in that 45 minutes defined time period. Keep a watch on your clock. The clock has to be in your head, it has to be now inbuilt, and you have to plan all your things accordingly, that I know I have started at this point and this is the time when 45 minutes are completing. So keep a watch. And 45 minutes, again, I would suggest that it is sometime difficult in the beginning to keep a track of the 45 minutes. So what you can do, you can simply divide your 45 minutes into 15 minute slot each. Keep a track with the clock initially. Later on, that clock has to be inside your head, that in these 15 minutes, my 1/3 of the 50 questions, 1/3 of the 50 questions, 1/3 of the 50 questions, they are complete. So broadly, you are giving kind of a minute for each question, broadly. In fact, it is less than that. I would say it is kind of 40-45 seconds for each question. Some of the question will be straight one-liners, some of the question will be lengthier. So that means again the division has to be done accordingly. Okay, so read very thoroughly right now, start doing that. It's very important to do that thing. All right, so one of the very important point which I want to emphasize here is this point, that your pharmacology, biochemistry, microbiology, anatomy, they are going to make base of all the clinical subject as well, and they are making kind of almost 1/4 of the paper, in fact little more than that, because the basic is coming from anatomy, basic is coming from pathology for the medicine part, from microbiology, pharmacology. So these are making a lot of your questions in your exam. So if you are little weak in any of these 4 subjects, I would highly recommend that please read these 4 subjects again very thoroughly. Don't try to skip a subject. Don't try to have that ideas in you that, sir, only 60 days are left, 19 subjects are to be completed, so I'll just go with the shortcut. Please do not do that. Okay, and please don't go with the idea in the exam कि सर ये वाला जो टॉपिक है ना, ये वाला जो सब्जेक्ट है मेरा एनाटमी, whenever I read the 2 topics, 2 options are good and 2 options are not fine, and I'm going to easily identify which one is my correct one. Please don't keep that guesswork for your exam. Whatever guesswork, whatever tricks, whatever trials you want to do in your exam, do them right now, because in exams that trials don't work, and you should all accept that thing right now itself. If you're not doing that, that means you are going for a very big mistake in your exams. Please don't do that. Okay, so do as many as hidden trials you want to do right now. It will be very important. Okay, so these 4 subjects are supposed to be very thorough right now. When you are now it is a high time when you all must be changing your lifestyle also. Okay, mental preparation is what I said. When you are giving the exam, you should be very much prepared with it, that how I am going to plan my GTs, how am I going to plan my SWTs, and whatever app you might be using, eGurukul or whatever it may be. So all the time in eGurukul you always have the option that you can plan your questionnaires in that way. So if you are the eGurukul subscriber, if you are the DBMCI student, I'm sure your eGurukul might be active right now. So just to go to the Q bank, just to go to the modules, just go to the AIMS PYTs, the PYQs, and start solving that. Right, as we have discussed, initial 40 days for your subjects from your own notes, 10 days for your PYTs, and the PYTs have been arranged very nicely in your eGurukul app. Right, I'm sure you might have gone through that section. And now you must be changing your lifestyle. Those who are little early owls, those who are little, night risers, so you all have to bring your cycles onto the same plane as the exam time period, right? I would again highly recommend that whenever you are planning your GT, plan it in the INI way. Plan it at the time of your INI. You know very well that exam is starting at this point and ending at this point, so you already know the time, right? Start shifting your sleep cycle, start shifting your daily routine according to the exam, so that the most active period of the day, when you are actually most active, it has to be that exam time period. And it is highly recommended, like in last 60 days, just 2 months apart from the exam, you start doing it, because it's not going to happen in just one day. You all know that thing. And if you try to be that champion that, sir, 10 days before the exam, I am going to be the one who can do anything, and last 10 days I'm going to change my sleep cycle, it's not going to happen. So gradually start shifting your sleep cycles accordingly. Okay, and then these, when you are talking about the round 2, round 1 will be 40 days, round 2, the PYTs, PYQs, as I said, please don't be adamant, sir GCT में तो यही पूछा था, यही पूछेंगे दोबारा से. So it is not going to happen. Whatever subject you might be talking about, the things are not going to be like that. Okay, so please do not have that adamancy in your mind. Be little flexible, be little choosy all the time, be little different all the time, and see if the question would have been same, why they have been repeating it all the time. So there has been a same patient of particular disease A which might be having variable presentations. So okay, so be focused on the presentation, don't be focused on the patient. Presentations are going to change the thing sometime. Okay, and that is what is going to make you or break you that particular day, right? Other thing is, whenever you are like practicing nowadays with your MCQs, with your notes, I'm sure that whatever source of notes you might be having, like I'm sure about my subject, my faculties, whenever they are giving you the class notes, if you have been the classroom student or DBMCI live student, we always make sure that in our class we ask you to highlight the most important point in that particular topic, in that particular dislocation. What is your attitude? What is a typical X-ray feature you might be having in the particular radiological sign, OBGY subject, medicine subject, or whatever you might be reading. So always have that eye and mind coordination. Okay, whenever I am reading a particular question, whenever I am reading my particular subject, my eyes should be well connected to my mind. See, mind will never be, eyes will never be able to send that relay to the mind, which you probably are not able to think that I can crack this language. Okay, so all the time, always have that concept ready from all the subject. Make sure that you are reading basics of all the subject. Basic and concept building is the key for any of your exam, and that too is applicable for your INICET exam as well, right? So try to read the topic in a way that all your memory is having a pictorial, graphical memory in your mind, that yes, this image was for this thing, this table here, this flow chart here, these important colors, highlighted notes that I made are for the particular topic. Okay, so eye and mind coordination is going to play a very, very important role. Any of your exam in your life is never about how much you are remembering. It is all about how much you are able to explore on that particular day. And that is not only about memory, it is about your skills, right? So start developing this skill from today onwards. Start doing it from today. So practice to crack this language of the question. Whatever might be the negative in the question, whatever might be the important point in the question, is the age important there, is the gender important there, is the pain happening in the thumb, is the pain happening in the back, might be like cuffing important there, or maybe expectoration important there. So those words have to be very, very easily captured by your mind, and for that, the training has to start from today itself. So start training your mind, start training your eyes accordingly. So coordination is very, very important. Sitting in the exam is one thing, and sitting with a complete strength, all your armors, all your weapons, is another thing. So gear up for that from today itself. Okay. Like I said, time management, avoiding in your exams as well, this is very, very important. Site again, I'm saying, please, that is the reason why we want to emphasize upon your own notes, because when you are sitting in the classroom, you have already highlighted those things, right? So it is again going to be very important. And unusual kind of questions, I have seen students sending me the messages from my platform, other platforms, about even not only my subject, other subject as well. Sir, this particular question I have never heard about that. Is it important for this particular exam? So unusual kind of questions during any of your exams, they are supposed to be neglected, right? 99% paper, it comes from the basics or the concept or the usual clinical settings. If you are the one who have been into the clinical scenarios, if you have been a good intern in your time, if you have been a person who have been always active in your routine ward rounds, if you have been very keen on seeing what is in front of you, maybe the crash carts, maybe the emergency trolleys, maybe the ambu bags, maybe all the cannulas, maybe all the Riles tube, all the Foley's catheter, fluids over there, how your seniors are managing a case of polytrauma, how the patient of MI is being managed, anesthesia has been given before the OT, and you have been keen observant that if the BP is going up and down, if the tachycardia is happening, what drug has been utilized and what and how that drug has been working on my patient. Okay, so if you have been a keen observer, trust me, the exam is not going to be that tough for you. Okay, it's going to be little easier if you have been a keen observer. So that has to be done. So what I'm trying to simply say is, unless a commitment is made, okay, rest whatever you might say, so commitment has to be the most important key. So unless you make it, whatever you are saying is a promise, is a hope, it might happen, it might not happen. So this word commitment, and that has to be done by yourself, to yourself, for this particular exam. And now guys, again, this is kind of like 3 hours now that we have got the notification that the NEET is preponed. So now let's utilize this opportunity, let's make it something very positive for us, and let's start preparing for the INI as well as your NEET exam. Okay, so those who are going for NEET, you should give your INI exam with your full strength, with your full capability, as if this is the only exam that you are going to appear in your life. There is no more exam after this. So first exam, appear for it as if it is going to be the last exam of your life. Okay, so don't be hesitant to give this exam. So this is what all I have to tell you guys: the round 1, the round 2, the PYTs, the first aid, the biochemistry, the microbiology, 4 major important subject, including this micro, biochem, anatomy, pharma. And this is what I have for all of you, that study while others are sleeping. So some of the people will still be talking about this, NMC has done that, NMC has done this, preponement, postponement. So don't be worried about that. Okay, work while others are delaying, and this is the time when most of the people will be discussing. So you don't have to be that one who is discussing. Whatever was supposed to happen has happened. People have tweeted, people have put a post on the social medias. That is all everybody has to do. And from today itself, I'm sure there will be so many who are going to help you out. All your faculties will be coming there definitely to give you their insight, their words of wisdom, maybe some things they might be providing you. So you all have to be just cautious about not to be too much into the social media. Don't just look at that, too much of everything is harmful. So prepare while others are playing. Okay, fine, the preponement, postponement, okay, I'm tired, I'm sick of all this, I'm going out of this. Don't do that, because most of the people, I have got like n number of messages with me, sir, again, sir, once again they have done it. So it is okay now, right? It should be a part of it. Emergencies may come anytime, and we all are born to tackle the emergencies. So don't be worried about that thing. It is going to come. And dream while others are wishing for it. And guys, this is why the INICET exam is definitely one of the most premier institute of the country, because they get the people who are actually believing in working, right, rather than just thinking. So if you have thought about it, start working for it. Unless you convert your thoughts into your actions, results are not going to come. Okay, so that is all from my side, and if you require any other assistance, just feel free to reach out to me, and I'll be more than happy to just connect with you guys. Okay, so INICET, NEET, nothing is a challenge for you. You all are born warriors, and definitely you can achieve it. If you're thinking of it, that means you somehow, somewhere you want to achieve it. So let's work for it. Not only think about it, let's start working for it from now only, right? So all the best to all of you guys. I'm unable to see this. Sorry. Okay. Yeah, so that is all from my end, everyone. So all the very best to all of you, and I'm very sure that you all are going to excel, you all are going to get the success in your life, and definitely you are the one who is having that zeal, that power to do it. All right, so all the very best, stay hopeful, stay positive, and yes, together we are going to achieve it. All the very best, everyone.